Pump it up, pump it up.
Trae.
Come on, come on.
With Trae.
Pump it up, pump it up.
It's the day with
This is
Trae.
the day to gain inspiration, to make a positive change in the nation. We're inviting you to partake in conversation, to raise your vibration. It's the day that we will all celebrate all of our peeps that make this thing elevate. Watch the negative fade away, cause it's the day with Trae.
Grand Rising, everyone. Welcome to the Day with Trae. I'm your host, Trae Holiday. I get to welcome you to a wonderful Wednesday. Really excited to be bringing you some great information today because my guest actually is Manny Santiago. He's going to be telling us all about the new benefits that y'all can get at Washington Healthplanfinder. So I'm so excited that he's joining me today. But of course, you're also joining me, and I'm excited for you as well. You get to join me in sharing this show with others who you feel could benefit from the daily dose of dopeness we love to give you here on the Day with Trae. And if you can't watch our TV show, you can always listen to us anywhere you find your favorite podcast. Just search Converge Media Network and the Day with Trae. You'll find me on your favorite platform. Well, before I get into it with Manny, I just got to say that it gets really exciting to think about all of the ways that we get to explore how Washington is stepping up to the plate. I think I'm hearing so much about the election and what are people doing. And honestly, it's always a politically charged environment right around presidential elections. I mean, before and after, there's so much energy that everyone is experiencing. And it's a great thing to know that no matter what, we live in a state where there is real protections being put in place for all Washingtonians. And the beauty of that is so refreshing. You know, I was just having a conversation this past weekend, and honestly, I was learning that there is so much great organizing work that has happened right here in Washington State. And I'm talking about people who go all over, not only the nation, but into other countries, are saying there's models that are being created here when it comes to community organizing. And if any of you out there know, organizing is really just about gathering folks, informing people, sharing knowledge, finding ways to utilize resources in a collective way, or to address needs of community, right? There's so many different ways that people organize. And it's a great thing because when I was a young girl, I didn't recognize how much my grandmother was organizing in her beauty salon. Let me tell you, there's a lot that's going on there at the barbershops, the beauty salons for so many different communities. And it's beautiful because that's where a lot of culture is shared. It's where information is shared, where people learn about some of the up and coming players, either in their industry or folks representing their city or their community. So honestly, the conversations that my grandmother was having while she was making sure everybody's hair was laid tight, it was amazing to be a young person in that shop, helping to sweep up hair, sometimes getting my own hair done, and being a stop place for me between school and home. So I grew up with these conversations that I didn't realize until recently how much of that was organizing. You know, some things can kind of move toward gossip, but when you focus on this information share, oh yeah, girl, somebody was just up in here. They told us we got to go here. We get to vote on this thing. This is what this bill means. You never know how information gets shared, but that word of mouth, that network is so vital to this very day. Now, of course, you got social media, you got all of the technology, but the truth is that still there's so many communities who rely on either trusted messengers from the community or people who are plugged in maybe at their jobs and they're sharing information that is public knowledge so that people can understand the benefit they have to that information. It's so beautiful because that word of mouth is still true to this very day. And so I want to give a shout out to all of those folks who are creating those spaces, who are the owners of real brick and mortar spaces where people are still coming in, sharing insights, information, sharing their opinions, sometimes having a good old debate about something. But without it, we actually lose sight sometimes of where our community is standing, where people get information, and the value of these spaces in our community is so needed. I just got to say thank you to all of you who put your energy into something that goes beyond just having a barbershop or a beauty salon or a restaurant. When you are one who is plugged into your community and what's going on, you are sharing that knowledge, and I want to thank you for it. Well, after this short break, we got Manny here who's going to be sharing some knowledge. I'm looking forward to learning more about what's going on with these insurance benefits with Washington Healthplanfinder. Y'all stay tuned. You don't want to miss it. You're watching The Day with Trae.
There's something magical, alchemical about being an artist. Being able to create, mold, envision, enlighten. This is a wonderful task. That's why I do it. My name is Joyce J. Scott, and I'm having my 50-year retrospective walk a mile in my dreams. Come on down.
Disney and Cameron Mackintosh's Mary Poppins comes to life on stage at the Fifth Avenue Theatre, featuring Step in Time and Supercalifragilisticexpialidocious. Make it a jolly holiday at Mary Poppins. For tickets, visit fifthavenue.org.
Hello, welcome to Elite Insights with Carlos Imani. We're looking to offer an in-depth look at event production industry through the lens of client experiences and joint successes. The podcast will emphasize guest interviews, focusing on client discussing their fields and reflecting on their collaboration with Elite Collective. Again, you're with Elite Insights. Carlos Imani here. See you guys in a few.
A world of wonder awaits at Pacific Northwest Ballet's The Nutcracker. Treat your loved ones to the Northwest's favorite holiday tradition at Seattle Center's McCall Hall. Visit pnb.org.
Welcome back, everyone, to The Day with Trae. I'm your host, Trae Holiday. Joining me right now, we got Manny in the building. What's up, Manny?
Hi, thank you, Trae, for having me here.
Absolutely. Now, you are the Chief Equity and Community Partnerships. Okay,
Yes.
I got it.
You got it.
Okay, so you do a lot of great work in
Mhm.
making sure that folks know what's going on when it comes to the Washington Healthplanfinder and
Mhm.
these benefits. Tell us a little bit more about your role.
Absolutely. So, as you said, my role is as Chief of Equity and Community Partnerships. So, part of my responsibility is making sure that equity is through the work that we do, not only internally within the Washington Health Benefit Exchange, which manages the Health Plan Finder, but also for the communities that we serve.
Mhm.
And then that's where the community partnerships come in, where it is our responsibility to make sure that Washingtonians know about the benefits that they have, the opportunities that they have to access healthcare plans through Washington Health Plan Finder. So that's part of my job. That's why I love coming to shows like yours to let people know about all the opportunities that they have and to let people know that when we are healthy, when we have a healthy society, when we have healthy communities, we can do way more. We can care for our families. We can care for our grandparents, like you were sharing at the beginning, right? Like we can care for each other and have healthier communities, more productive communities, and communities that continue thriving.
Yeah, no, you're absolutely right. And this is why, health insurance is so vital.
Mhm.
I mean, I think there's still a lot of people grappling with some of the confusion.
Yeah.
We call it Obamacare and all of
Mhm.
this, but it basically meant the market got open for insurance agencies to go direct to consumer,
Mhm,
right?
exactly.
And so based on your income and things of that nature, you can qualify for different plans.
Yes.
Can you just give us a summary of this so people understand exactly what we're talking about here in terms of benefits?
Absolutely. So as you said, and this is very important to clarify with people, especially now after elections, the Affordable Care Act is what some people call Obamacare. It is called the Affordable Care Act. One of the main points of the Affordable Care Act is to make sure that people have access to health plans that fit their budget, right? So, and we do that through certain subsidies, certain benefits that different people have. And the exchange, which is, the organization that manages the Health Plan Finder, what we do is that we put all these plans together, all the private plans that the market has, put them all together in one place so people can compare, people can see what the benefits are, people know how much they cost. And it's very important for people to understand that we are not the ones who set the price, right? The insurance companies are the ones that set the price. But at the exchange and the Washington Healthplanfinder, they will see all the plans and compare and pick the one that makes sense for them according to their family size, their family income, including things such as where do you live, right? A plan in King County might not be offered in Grant County, but those different plans, will fit you according to your needs. So we have all 39 counties covered. We have hundreds of different plans for each person that comes into the market. And yes, the market is there to make sure that you can compare so you can pick a plan that fits your needs.
It's so interesting because I think people are like, okay, so then what does that look like for me? But there are folks to help folks do this. I mean, I think that's also a misnomer too, because it's like, hey, it's available for you to go ahead and get on the site. But tell us a little bit more about the support that's offered.
Absolutely. That's very important, Trae. So yes, the website and the application, you can self-serve. If you are a digital native, you might find it easy. But we also know and recognize that not everybody understands those processes, or as you know, healthcare is so complex in the United States that if you're new to the system, or if you're young, you might know about, a website, but the system of healthcare might be very complex, very complicated. If you're older, you might not be familiar with a website, right? So we have a whole network of navigators throughout Washington who are there in person to help you navigate the process and navigate the application for health plans, right? So these navigators, we have about 1,000 throughout the state. All of them speak not only English, but many of them speak other languages. And we also have access to translation services for over 200 languages, including indigenous languages of Latin America and African languages. So it's very important that people know that wherever they are in Washington, whatever language they speak, whatever level of confidence they have with websites, there's someone there ready to help you. And these navigators are not our employees. They are not, government employees. They are not with Exchange. These are organizations that we fund, organizations in your community who know your needs, who can help you navigate this system. So very important. These navigators are your navigators. They are in your community. They know your needs, and most of them speak your language.
Wow. I mean, that is the level of intentionality that really gets exciting for me, because if I'm thinking about picking a plan. Now, let me tell you something. I've picked many a plans, okay? But understand, and to be honest, I actually had my insurance license for 2 years. But if you get me to talk about deductible, how much is out of pocket, how much am I spending, right? Because I think sometimes there's a huge misnomer that, oh man, if I get this, like, look at what I have to pay when I'm in the hospital or at the doctor's office versus that deductible. Well, if I don't want, a high deductible, then I got to pay more. If I want a low one, I got to pay less. Whatever it is, right? It's like there's a reverse. So you're right. There's so much to navigate. I love the fact that y'all have been really intentional to make sure that the state is covered, because I can't tell you how many times I've heard, man, over here, maybe Eastern Washington, they didn't care about us. King County got everything, right? So I love that. But when we think about the deadlines, right? Because I mean, these plans, they're there for a moment of time. And people got to sign up, right? What does that window look like? And tell us more about that kind of process.
Absolutely. So open enrollment is the period that we have for people to come into the market, Health Plan Finder, which is our website, and pick a plan, right? In addition to the navigators, I should also point out that we also have a network of over almost 2,000 brokers in Washington and outside of Washington who help Washingtonians access health plans. So it's not just the navigators. You can also find a broker on our website. But excuse me, what happens is that once that you pick a plan, yes, you will have different levels of premium and different access to different things. I'm losing the question, the original question.
You were just walking us through the process for
Yes.
someone. Yeah.
Thank you. So once that you pick a plan, you have actually, if you are new to the system, if you are applying for a plan for the first time, it's open enrollment. Open enrollment is from November 1st through January 15th. So you only have like 3 months or so to get a plan, 2 months and a half, right? So it's very important that people know, if you're new to buying a plan on Healthplanfinder, you have from November 1st, which already passed, through January 15th. But very important, if you want your plan to start on January 1st, then you have to apply by December 15th. So those are the important dates. November 1st through January 15th, open enrollment. If you want your plan to start on January 1st, then December 15th is your deadline to apply.
No, that's a really great distinction.
Yes.
Because, a lot of folks are, especially if they're doing this for the first time, they may really want to understand that difference
Yes.
there. But when I think about people who have lived without health insurance for so long,
Yeah.
I mean, everything has had to be essentially out of pocket
Yes.
for them.
Yes.
And so just tell us about the real benefit for families, Manny, when we think about people who have not had access to health insurance now getting that access.
Yes, that's very important. So right now, and I say right now because we don't know what might happen, in the future, but right now for all of 2025, the federal government and the state government subsidize certain plans. And to apply for those, to apply and qualify for those plans, for those subsidies and tax credits, you must apply through the exchange. So that's very important. People might want to go to their broker without really, going through the exchange or not asking their broker or the navigator to use the exchange. But the important part of using the exchange is that it's the only place where you can get the federal and state subsidies that you might qualify for. Now, if you are a person of limited resources, it is very important that you find a navigator that they can help you navigate the system and the process, so you know how much you can qualify for in subsidies and tax credits. And that's very important because healthcare plans are really expensive, but right now and for all of 2025, we have subsidies that you might apply, that you might qualify for. So it's very, very important that you go through the website, that you find out, how much you qualify for, because I was just talking with some people, right? Like they can pay, I don't know, like $200 instead of the $600, so $100 and something, depending on where you live, your income, and your family, how many family members you have, and things like that. So
yeah. Well, you're talking about, so all of this is there on the website. I mean, if I'm somebody, I need the navigator, I don't know what I'm doing, I'm gonna get all that support there. So
Yes.
I love that you guys have centralized it. But of course, I got to talk about this, Manny, because we're talking about health insurance for everyone. Let's talk a bit about this immigration status. I mean,
Yes.
is that a part of this? Folks who are like, yo, I'm not trying to sign up for nothing. My name gets put out there. And if I'm undocumented, I'm now, in lieu of all, like you said,
Yes.
who knows? When it comes to me having to be ripped away from my community, my family, tell us a bit about any of those kind of protections. And is this available to all of our folks here in Washington in that way?
Absolutely. So the great thing about Washington is that, as you said at the beginning, right, when you were opening the show, Washington still has protections for Washingtonians. If you live in Washington, you're protected in so many ways. The laws here are very, they really take care. We really take care of each other in Washington through the law, right? And one of those things is that in Washington was the first state that got the federal government to give us basically permission, right, to sell insurance through the marketplace, through the exchange for undocumented residents. And I know that a lot of people think of undocumented residents, as only Latino people, but that's not true. We have undocumented residents from all the world, including Canadians who live in Washington without proper documentation, right? Those are some of the things that people don't always pay attention to. And these residents in Washington who might not have proper documentation to live in the United States, in Washington, they have access to health insurance through the exchange. Now, it's very important that people understand. We at the exchange, we have a commitment with our communities that the information that they share with us is protected. And that means that the exchange doesn't share your citizenship status with any national federal organization, any federal agency. It is only used to determine if you qualify for the state subsidies that are available for undocumented Washingtonians. The other thing that is very important to point out is that because this program, so the market, anyone can buy at the price that the insurance sells on the market. But if you qualify for subsidies, you're an undocumented Washingtonian, you qualify for subsidies, it's very important to understand that right now that program is capped. So, there's a limit to how many people can access that. But very, very important, if you're undocumented, you go into the market and into the exchange and find a plan, you do not qualify for the subsidies because the program is capped, right? It's very important that you still submit that application. You don't have to apply to pay, but it's important to submit that application because that is a way that we have at the exchange to show the Washington legislature that they need to increase the funding for that program. So we are really urging people, do not feel like, if you don't have the money to pay, we know that it's hard because you might not be covered by a health plan, but do not let that stop you from actually submitting the application because we need to show the legislature that a lot of Washingtonians could benefit from them expanding that program, right? So those are very important things to point out. So from November 1st through January 15th, all Washingtonians, regardless of citizenship status, can apply for health insurance through the market.
It's quite groundbreaking, honestly. Yes. This is a changing country. I mean, it started with folks coming here, right? And not recognizing those who were already here. So yes. the ideas for me, it just always goes back to the beginning. And I go, who was already here, right? Nobody discovered this place. It was already populated. They already had customs and traditions. So I really enjoy hearing the ways that we are being responsive to the diversity that we have in our state in particular, yes. Right? And so thank you for sharing those details. Now, folks are like, okay, where do I go to apply? Please let them know right there, Manny, how they put their application in.
You can apply at wahealthplanfinder.org. wahealthplanfinder.org. That's the only place where you can find the subsidies, where you can find the tax credits that you might qualify for, and where you can find the plan that fits your family needs and your personal needs for healthcare.
Wow. Manny, thanks so much for your work.
Thank you.
Absolutely. Thanks for being here. Y'all, I mean, there it is, right? We get to hear about this information directly from somebody who was talking about how they are centering equity in their practices and approaches, and how Washington was one of the first ones to say we need to make sure we have some subsidies for everyone in Washington state. So make sure you get your benefits today. If you're somebody who has never had insurance, or maybe you're used to the exchange and you know exactly how to get back on Healthplanfinder and get your insurance. If you're new or old, please make sure you get your benefits now during this open enrollment period. Y'all, I'm going to wrap it all up right after this short break. Stay tuned. You're watching The Day with Trae.
Urban League of Metropolitan Seattle is bringing a whole lot of star power to town as Taraji P. Henson and Hill Harper headline their 23rd annual breakfast happening November 22nd at the Seattle Convention Center Summit. Grab your tickets now at urbanleague.org.
Africatown Plaza is our latest affordable housing development project. It's 126 units of affordable housing over community commercial space.
It's the first time in my career, and I've been doing this for 10 years, that I was able to design for people who look like me.
Africatown Plaza is a beacon of hope.
Africatown Plaza is a love letter to the community.
All right, y'all. Welcome back to the Day with Trae. I'm your host, Trae Holiday. You know, I'm over here still talking to Manny during the break. Manny said, and do you know for tribal members, they are not beholden to that open enrollment period. So they get to apply all throughout the year. So I just wanted to make sure we got that on the record. You know, this for me is always a space where I am learning right alongside you all. And trust me, this is one of those programs that is doing the work. I mean, we're talking about protections all around, and we understand how a lot of families out there are wondering what's going to happen. So just know this is a protected space, and oftentimes in other areas, we understand how sometimes that's not the case. So I'm so grateful for that level of intentionality to serve all Washingtonians, regardless of citizenship. That's a big deal. So I'm inspired, of course. I want y'all to be inspired, because no matter what it is that you're doing, if you have something revolutionary happening at your job and we all need to know about it, make sure you hit up the Day with Trae at whereweconverge.com so we can learn all about the great work you're doing. If you know somebody, then tell them to hit us up. At the end of the day, this platform is really about elevating those who are doing great work. So I want y'all to be inspired, okay? Some of y'all might be afraid to share your story, but I tell you what, you never know how that is going to impact somebody else until you do it. Thanks so much for watching. I'll be back with y'all tomorrow. Until then, at 11 a.m., peace.
Converge Media produces culturally relevant content for Black and urban audiences. Our coverage is raw, transparent, and objective, praised by community leaders, government officials, and residents. Support Converge Media today via Venmo, Cash App, or PayPal at Converge Media.